morning, everyone. Today is Thursday, October 19th. Thank you so much for joining into our weekly HCR webinars. There is a lot to discuss. As you know, we are rapidly approaching 11/1, which is the start of the individual medical open enrollment season. And of course, we are well into fourth quarter for our group renewals for the 12/1s and 1/1s. So it's a lot of busy activity, and certainly a good time to take advantage of the turmoil in the market and to make sure you retain those clients. We do have a lot to talk about, and a lot of things are changing very quickly. So I am definitely glad that you are joining in every week to learn the latest. Just with a show of hands, if you can let me know if you can see my screen, I'd appreciate it. Awesome. Great. Okay. If you are new to this format, my name is Deb Wilkinson, and you can ask questions during this webinar. You can do it one of two ways. You can either raise your hand, the virtual hand, pardon me, on the control panel to the right of your screen, or you can just type in your question at the bottom. I will tell you everything I know. There's just a lot of unknowns right now, and for the individual market, we're pretty much used to the last minute, but this is really pushing the limit. And I don't know that things are done changing yet either. So let's just hop right into it. First and foremost, funding for CHIP, it's still not done. Funding expired September 30th. There are a lot of folks that are concerned about this, but I can tell you that no one is going to defund CHIP. I mean, please, just the optics alone would kill any political career. So I don't think that's an option at all. There has been some activity on it, but there's no Democratic support for the refunding of CHIP because the GOP wants to take some money from Medicare and also, pardon me, the ACA. So, of course, Democrats are not going to support that. So it's really going nowhere. What everyone is saying is that the states will be fine because they do still have enough residual funding to last a couple of months. So it doesn't look like this is something that's going to be immediately addressed, but certainly will be addressed. And I don't think that it's going to have a bad outcome. I just cannot imagine any state defunding CHIP. There was also no movement on the Lamar Alexander, Patty Murray ACA Repair Act, but as many of you have been watching the news in the last couple of days, Lamar or Alexander and Murray are putting back together this act. It does look like the president will or will not support it. It could be a 2-year fix. It's really a crapshoot. And what that means at this late date when rates are already approved, I don't know. I'm trying to find that out, if it's something that the rates that are approved now could change or not. I've been told it's too early to tell. So, again, all of this stuff just causes more turmoil and instability in the market. We're watching it, but I can't even guess at the outcome at this point. So will it be a 2-year fix? I don't know. The president has been a bit back and forth on it and sending mixed signals. The executive order that President Trump issued last week, which would allow for interstate sales with association plans, extend the moratorium on the 89-day limit for short-term medicals, etc., that is being met with a lot of legal challenges. Additionally, there is, for the most part, 60-day comment periods, 180-day comment periods. So even if the executive order was not met by legal challenges, it's still not an immediate effect, or would not have an immediate effect on anything that we're doing on the group health market or individual market for right now. 18 states plus DC filed an emergency motion to continue the cost share reduction payments. Pennsylvania is among them. This is, again, it would be included in the ACA repair bill. and who knows what's going to happen. Payments are due, and I'm not sure what the outcome is going to be because it really depends on what minute you read or listen to any news, and to decide what is going on. It's really almost comical at this point. The individual mandate, this is very important. The tax penalty, the IRS says that they will indeed be enforcing the tax penalty and reject any tax returns that does not indicate that a qualified health plan was or is in place. So just be mindful of that. There was some information that came out earlier this year that basically said the IRS would not reject tax returns if that box was not checked. But what they did is they followed up after the fact. What the IRS is saying may not be what the president's saying, but the IRS is indeed saying that it is the law of the land and they're going to enforce it. So whether that's true or not, I would encourage you when you are talking to your clients to absolutely make sure that you let them know that although there is some confusion in the market, it is the law, and the tax penalty, according to the IRS, will be enforced. So let's talk a little bit about the affordability factor. We did mention this last week. I think this is very important, obviously, just for the group health market. So I wanted to once again show you this chart. For 2018, the FPL limit has been raised, or amount has been raised, but the affordability percentage has gone down. It still increases the monthly max that an employee can be charged for the single-only premium on group health insurance. That's one of the safe harbors. But I wanted you to at least be aware of it, because for those of you in the group market, it certainly is something that you have to deal with every single day. If you have any questions on that, just let us know. Sorry about that. This is a big one. Highmark Direct Blue. They're individual 2018 plans that will be issued under the Direct Blue name, not Community Blue or Flex or any of the other names that could be coming out for 2018, but the one specific to Direct Blue and specific to individual UPMC Pinnacle systems will not be in network. So that is a big issue for Central PA, obviously. So I just found this information out yesterday. They sent me the link and a heads up. So I just wanted to make everyone aware of that. That's obviously detrimental for Dauphin County because the Pinnacle hospitals are huge. So be mindful of that. If you are still selling in the individual market and you're in Dauphin County, or your customers use Pinnacle, UPMC Pinnacle systems now, Direct Blue programs are not a good option for them. For Capital Blue Cross group submission deadlines, I just wanted to reiterate that the 15th of the month is the deadline to submit to the carrier. That's their deadline. There's no more late letters. There's nothing. If it's not in by the 15th, they don't get coverage for the first of the following month. They get pushed back until the following month. So just please be mindful of that. We can't ask for exceptions. It is what it is. We're going to try to help as much as we can, but if we get it in on the 16th or after business on the 15th, it is not going to get the next available effective date. Prime Pay Promotion. This is our partner for COBRA. They also provide a lot of TPA type services such as health reimbursement arrangement, administration, HSA administration, a lot of different, FSA, of course, different funding accounts. They are running a promotion. I did include the broker year-end sales promo flyer for you. Essentially, they waive the setup fees. 1/1 and on group renewals is a big time to set these funding accounts up. So if you have a group that is interested, now's the time because the fees are waived. Pennsylvania Insurance Department rates. So let's talk a little bit about this. I have the link here, and if you just Google PA Insurance Department, you're going to see it. But I wanted to, I'll bring this up, see if I can bring it up. If you come to the Pennsylvania Insurance Department, this will bring you right to the rates. You can see the rates, what was requested, what was revised in a request, and what was approved. You can also look at final filings for individual and for group as well. And you can look at the age-banded rates for everything, for the groups, and of course the age rates for the individuals. We get a lot of requests for those quarterly paper rates, and although these rates may change, and they do have quarterly trends and can change each quarter, this is a good resource for them. You can certainly ask us, but if you want to look at the 2018 rates, you can go anywhere here. For instance, Highmark's rates, first quarter rates are not out yet, and they're supposed to be coming out on Monday, but you could go to HHIC and take a look at them if you chose. The rates are not pretty, folks, that's for sure. And what they're telling me is, let me go back to my screens here, and then we'll continue that conversation. What they're telling me essentially is that they filed rates for anticipating that the individual tax penalty and the cost share reductions will continue, and they filed a separate rate in the event that the cost share reductions were not going to be granted or the tax penalty would not be enforced. So it looks like we have closer to the unenforced sort of activity. What I've been told is obviously the silver plans on the individual market, that's where the source of how the subsidies, the tax subsidies are calculated. So if you raise those silver level plans, then subsidized folks are not really going to feel the pinch like unsubsidized folks would, if they choose a silver plan. What you're going to see, though, is a silver plan that is more expensive than the gold plans. So don't be alarmed. That's how they are this year. And the insurance department encouraged the carriers to file a silver plan off marketplace, so without the additional ratings. So what you're going to see are silver plans that are very expensive on and off, and then you're going to see off marketplace a silver plan that doesn't have that additional increase to make it more affordable. But again, it's going to be something else. We should have more information on Monday, and obviously our webinar next week we can talk about, or you can give me a call early next week. I'm happy to share whatever information I have. It's just really coming down to the 11th hour this year. So let's go to, well, here, income-related exemptions. Again, if you are working in the individual market and your clients, the cost of the lowest plan offered exceeds 8.16 of the household income, then you could get an income-related exemption from the tax penalty. But that doesn't mean that your coverage is, you'd still have to get coverage. But if you didn't have coverage, you would avoid the tax penalty if you met those guidelines, the 8.16. All right, so let's talk about what everybody wants to know, and that is individual carrier commissions. What's going to happen in 2018? UPMC, the Western PA carrier, they are paying $10 per member per month. That is reduced from $17 last year. They are, and that is specific to the two lesser networks, not the premium network. So there is no commission on the premium network. They are expanding into counties. That doesn't include a general agency, so we're not in that mix. I'm happy to get you all the information I can when it's released for the expansion territories and pass that on to you. But unfortunately, it's not something we can support because it's not something that we have access to as a general agency. Independence Blue Cross, they are paying commissions for 2018. It does include the 2017 new business that was written last year and not paid. We still do not have the Sentinel or the Sentinel Elite attestation link for them. I'm not even sure if there's going to be one this year. They're working on trying to get some information for me. I just don't have that yet. But the good news is they're paying commissions. Capital Blue Cross at this date, it is renewal only, but that's just word of mouth. There's nothing that has been posted. So I would expect renewals only. The Personal Blue, the non-ACA plans, they are renewing. There is a webinar that's scheduled for Capital, and that is Tuesday the 24th at 9:30. I was supposed to get the announcement. Everybody that's licensed with Capital, directly with Capital, or will get that information directly from Capital, but once I get that, I'll certainly include that as well. But just kind of keep that time frame open if you have an interest in learning about Capital and their individual strategy and products for 18. Again, that's Tuesday the 24th at 9:30. Highmark for Central, Western, and Northeast. I don't have any news yet. There is speculation and rumor that some products may pay where others may not. But again, that's just a lot of rumor. There's nothing posted and nothing definitive. And at this point, I don't even know if anything that's been established could possibly change. I have a message into the insurance department to see if, because of some of this vacillation with, you know, the Alexander Murray bill, you know, and if that would allow the carriers to go back and change the rates or refile for new rates, or if the insurance department can do that, you know, on their own in light of the information, I don't know. So at this point, Monday's going to be a big day if they can get everything together and release it on the individual side. Geisinger will continue with that, renewals only. So I know there's a lot of information we talked about today. None of it's really good news, but, you know, news nonetheless. So let's open it up now for our questions and open forum. Let's see what questions we have. Ooh, we have a lot today. Margie says that she's very interested to learn how the association groups will affect her small employer group business. Yeah, it is interesting, Margie, and I imagine just like anything, if it is something that is going to be passed and accepted, that they'll start off attractive. But, you know, these association plans have been tried numerous times, and essentially what happens is it's a smaller risk pool than even an insurance carrier has. So if an insurance carrier has trouble maintaining rates on a large risk pool, imagine what a much smaller association risk pool will do after a couple of years. So it may be a solution early on, but the rates are going to increase, and there's going to be adverse selection just as there is in any other group segment, maybe even more so. Dave says, is the CBC group 15th of the month deadline for new plans only, or does it affect plans changing during renewal? I don't know. Oh, it's new plans only. The renewal deadline is 5 days before the renewal effective date. So new group plans for Capital, 15th of the month, cutoff, no exceptions. For renewals, it's 5 days prior to the renewal effective date. Nancy asks, why are rates approved for higher than requested? Well, it's the same as last year, Nancy, and I know the excuse or the explanation, I'm sorry, I didn't mean to be disrespectful, but the explanation we were given was that the insurance commissioner wanted carriers to become stable and to stay within the market so that Pennsylvania citizens have choices. So last year, they actually approved higher than filed because they wanted to make sure, again, there was stability in the market. And also there was an additional caveat that we were told that, you know, this year they filed large last year and approved even larger last year, so that this year they weren't going to get anything more than a 10%. Well, of course, the market changed and that went out the door. So I think it's two perspectives. The insurance department wants to make sure that everything is stable, and the carriers want to make sure that they're accounting for the loss of any cost share reduction money. But I mean, please, who can accept these rates, really? Who can even unsubsidized afford these rates? That's why we're really thinking that this is the year that the cost share or the Christian Health Share Ministry plans that people have been selling in the years past, the one that we're promoting in our webinar on November 3rd at, I think, 9 o'clock, that is something that I think you can make hay with because it can be sold all year. The Christian Health Share Ministry Association membership negates that tax penalty. So again, it's not a one-size-fits-all, but it will fit some. And of course, the National General short-term, where you can buy 4 policies at once, so that to get you through the entire year. That's where I think we're going to see some movement. I don't think unsubsidized folks are going to even be able to deal with the rates, let alone afford them. So I think there's some opportunity there to make commission on some other plans. Tracy says, have you received any information on commissions for the next year? Only what I shared, Tracy. Dave asks what the UPMC expansion counties are. What we are hearing, it's Lycoming, Tioga, and Berks, but there could be more, Dave. And Margie says, what was website for 2018 individual plans? Margie, I can email it to you. If you just Google PA Insurance Department, you'll be able to get there, but I will email the link to you. And Jim says, did you say something about a Christian Health Share Ministry webinar last week? If so, is there commission to sell it? Yes, there is commission, Jim. And you're educating on the Christian Health Share Ministry plan, giving them the link to join, which is $45 per person. So you're not selling the Health Share Ministry. It's just a means to the end to get to the limited medical plan, the accident plan, and the CI plan that you can sell. And it is commissionable. It's about 22% commission, if you sell the accident plan, et cetera. So I think that's pretty darn good. And that is November 3rd. Kim says, can you remind me who is the carrier selling short-term medical? National General, I think, is going to do the best job because, again, they have where you can go in as a 1-1 and sell 4 consecutive 89-day policies with just one entry. When one policy expires, the other one reissues. It's a reset of deductible, of course, reset of pre-X, but it avoids having to go in and rewrite a policy 4 times. The IHC also has a short-term program. Okay, so Elise has typed in a note. She says, please note that Capital will get auto-renewed 10 days prior to the renewal date. So if you do wait 5 days, the group is going to get incorrect cards. 10 days prior to renewal date is what they should aim for, or they need to be very clear about the cards and the bills, because it's going to be reissued or renewed 10 days prior to the renewal date with their same plan. So if any changes are coming, it's going to be mass confusion. Mike says, so my 2 CBC small groups that I received for 1-1 renewal with 20 to 24% increases do not fit into the filed rates you showed, as those are for new business only. Kind of. I mean, the trends, the age bands are the same. So you're gonna, the 1-1 rates that you have are accurate for Capital. At least that's what they're saying. And even when you look at the filings, it's not straight across the board. Some plans may have a 10%, some plans may have a 4 and it averages out to 5. So it's not a straight shot of X amount of increase. And Mike, we can shop those for you. We just don't have the Highmark rates. And I don't know that Highmark's going to be any more competitive. That's the real issue. Everything is going up in price, and there's not one carrier that's coming in lower than the market. But we can certainly do what we always do, and we can quote it and look what's out there, and then you can do what you always do and go back to your clients and say, this is it. This is what we have. And let's see. I have sent the registration for the webinar. That is in my newsletter that's coming out, and it's also in our weekly training, like the upcoming training email that goes out on Tuesdays. So it's in both places. And I don't have the link for the Capital webinar, and you'll be getting that directly from Capital. When I get it, I'll certainly send it out. Are all companies waiving participation requirements for 1/1/18? On the group segment, Margie, from 11/15 to 12/15, any small group can enroll even if they don't meet participation. However, the caveat is they have to meet participation by renewal. So that's an ACA rule. That's not a carrier rule. So all group health plans. In order to sell the ACA and limited medical plans, must the member buy the sharing plan you are recommending? Yes. This particular Christian Health Share plan has to purchase this Christian Health Share plan. It is $45 a month. So if they wanted to purchase another, it could be much more expensive. But this one works in conjunction with the limited medical product. And that is it. A lot of questions today. We'll keep watching and getting all the details we can. Next week, I'll be back here, and that will be the 26th. So that is the last Thursday that we'll meet before open enrollment starts on November 1st. So hopefully we'll have a lot more definitive information, and keep your questions coming. You don't have to wait for our Thursday webinars. If you have a question, just shoot me an email or give me a call. I'm happy to let you know I don't know the answer or to go and find the answer for you. As always, I truly appreciate everyone joining in, and I wish you all a great balance of the week and a wonderful weekend. Bye-bye.